Welcome to another installment of Long Story Short Members Chat, the show where we interview members of Austin's community. This week, Long Center members are joined by guests from Baylor Scott White. We record these shows live for members and post them on our channels later for free public access. Members watching live have the opportunity to ask questions of our panelists using the Q&A feature at the bottom of your screens. If you'd like to become a member and join us for the next Long Story Short Members Chat, sign up today at thelongcenter.org. My name is Abby Sandlin, and I'm Chief Revenue Officer of the Long Center. I'm very excited to host a long story conversation with Baylor Scott White, official healthcare partners of the Long Center. It's an honor for us to have their unwavering support for the Long Center, artists, and our creative community, especially at a time when Baylor Scott White is doing so much to help Central Texans. Let me introduce our guests today, Dr. Jessie Everline, Director of Hospital Operations, and Dr. Pallavi Mukkamala. Welcome to the show, Jessie and Dr. Mukkamala. We're very excited to have you with us today. So I'd love to get everybody started today with each of you giving us a little bit of a background about Baylor Scott White, your role, and kind of what we can expect to chat about a little bit today. So Jessie, how about you start off?
Yeah, I'll kick us off. So Abby, once again, we're delighted to be here with you and the Long Center, great partners in the community. Just a little bit about Baylor Scott White. So Baylor Scott White, if you didn't know, is the largest not-for-profit healthcare organization in the state of Texas and one of the largest in the country. In 2013, Baylor Scott White Health and Scott White joined together. Two very well-respected, best-in-class organizations came together to form Baylor Scott White. Here in the Austin region, we have now 8 hospitals throughout the region and over 70 clinics, and we're excited to continue to serve this community and once again partner with organizations like the Long Center.
Great. Dr. Mukkamala.
Hi, my name is Dr. Mukkamala. I am currently a family practice physician at the Baylor Scott White system. I work in one of our clinics here. I'm located at Circle C, and I have been a part of Baylor Scott White since residency, so I'm very happy to be here.
Well, welcome to you both. Thank you so much for joining us. Here at the Long Center, we've spent the past 6 months now innovating and getting very creative about how we maintain connections between artists and the creative sector and the community. You know, even when the virus began, it didn't stop creativity. In fact, it created new opportunities for creativity. And we've been really excited and challenged about finding ways to maintain those connections and keep artists performing and the community inspired. And you at Baylor Scott White have been innovating to save lives and to maintain the well-being of our community. So I'd love to hear a little bit about, kind of first what your role was, in March when the virus really started to become apparent to us, and how you were innovating to be able to continue serving everybody. And then also kind of how it's evolved to today and what you're seeing today in your clinic.
Yeah, definitely. So it's certainly been an interesting time, and I think that's been the case for all of us. But here specifically at Baylor Scott White, I think our reaction to all of this was pretty swift. One of the first things that we did was we initiated the first drive-through specimen site collection in the state. So that was a really great thing to have, and then that way it ensured we could get everyone tested pretty quickly. Soon after, we were able to see patients through these sort of drive-through visits or curbside visits, as you say. So that way we're seeing patients safely for things like immunizations or checks and things like that, which was really great for some of my immunocompromised patients. So that was a great next thing that we did. And then of course, telemedicine has been a big part of how we've innovated. Pretty much overnight, we all had training and we were all able to go ahead and get our training done and then see people. And that way there was no significant delay in care, but of course we were always open, and we've still remained open through the whole thing. So that way we were always able to see patients in person too.
And so now, several months how are you continuing to adapt, or what are some of the activities that continue to go on that were different than how you might have treated patients or seen patients before?
Yeah, I mean, certainly, of course, one of the biggest things that we've introduced is the safe care rollout, essentially, with Baylor Scott White, which it focuses on patient safety as being our top priority. So we implemented new measures and protections across our hospitals and clinics and surgical systems. And of course, that included several things. First thing was when we had COVID positive patients, for example, they have this home monitoring digital care journey. So they were able to go through the app, and if they were positive, they were able to check in. There were people looking out for them. And then if anything escalated, they were quickly routed to us. So that way there was no significant gaps in care, which was one of the great things. And then next, of course, making sure patients who are having procedures or surgeries done were getting in for COVID testing. So that way we didn't bring in too many sick people. So again, safety was key. And then virtual waiting rooms for patients coming into clinics, and also patients going to our hospitals and inpatient settings, as well as loved ones who have, patients that are in clinics or in hospitals, And so because then in that way we could update them via text message or phone call. So again, that way protecting everyone, which is our biggest motto with that whole safe care implementation. So there were some of the things. So it's been good, but at least, we've been noticing that we've been able to keep people safe, which has been the most important part.
Absolutely. Absolutely. Here at the Long Center, I mentioned, some of the new techniques that we're trying to implement as well. We've turned our Rollins Theater into a recording studio so we can capture artists performing or different activities. We are figuring out new ways to use our space and capture content, but figuring, ways to also allow people to feel like they're connected and not just, watching a performance, but really engaging in it. And a couple of things have really perked up for us that we realized are unique opportunities that we want to continue. And were unexpected silver linings, I might say. And one example I'll give is in April, we were supposed to be hosting our the Heller Awards for Young Artists, which is our annual celebration of musical theater for students, musical theater students, and their performances throughout the community. And one of the biggest challenges we've had year after year is that more people want to attend this live event than we have seats in Dell Hall for. So by turning it into we moved very quickly to turn it into a virtual activity, lots of Zoom choreography, and turned it into a really engaging video. But the best part was we were able to reach so many more people than we could because we weren't constrained to just the seats we had available in Dell Hall. And we've really leaned into that and thinking about, how we can continue to use technology even when we're able to get back into our building, and how, and there's going to be a phased approach about being able to come back safely to the Long Center. How can we tap our virtual channels to be able to keep people connected? And into the future, how do we just keep growing that and leaning into that? I'm curious if you found any silver linings or things that surprised you as you moved towards a lot of this telemedicine or, the new innovations that you're looking forward to continuing into the future.
Yeah, I think one of the things was I have patients who have poor transport, and so lack of transport causes them to delay care sometimes. Still there are certain things that they have to be seen in clinic for, but sometimes just to monitor, we can see them over, different ways. And one of the great things has been telemedicine. And so that sort of forced them to sort of download the app and have all of the things. And that way I can access them, we can check in, make sure everything's doing okay. So that way we don't like, have any mess ups or have them like, go to the ER or something like that, and delay care essentially. So we've been able to keep up with them, and then it's just something that's been a very good thing. So even going forward, hopefully we can, see them occasionally, but sometimes if they just cannot come in, it'll be a great thing to implement.
That's great. Yeah, I know, the concept of telemedicine has been percolating for a couple of years, but this really gave us an opportunity to see how it works. And I, as a patient, have benefited from it as well, just to be able to touch in with my doctor or a nurse on something quick that, doesn't need to be scheduled. So it is exciting to see the benefits that we're going to be able to see long term. Jessie, I'd like to chat with you about, your role in a medical, in the actual medical center, and you were really looking at innovations that are happening within the hospital setting. So I'd love to hear kind of about anything that you've seen that's changed or improvements that you were able to implement and see them at play.
Yeah, thanks, Abby, for the question. I think Dr. Mukkamala has done a really good job of highlighting some of the things that we're really, really proud of in terms of standing up our virtual waiting rooms and the drive-through clinics. I think what I'd add from the sort of leading the hospital operations at our newest facility, actually in Southwest Austin Medical Center, is, we partnered with the clinic, and some of the things that we may not have thought about before that we've actually sort of were prompted to do is, early on in the process, we and many other organizations across the country, did the right call with minimizing visitation in the facility. That's a tough thing. It's a scary time for individuals that have to come to the hospital, and then you lose some connection with your family because they can't actually visit you while you're here. Well, what we did is we actually used iPads. And so we actually had a few instances here where family were physically on campus, couldn't come in, but we used FaceTime, which doesn't seem very innovative, but they were able to connect with their family inside of the room as opposed to not being able to see them at all. And those types of things that we quickly pivoted to, in addition to all the other things that we've done, have been really highlighted in terms of our ability to be creative. The other thing I'll note is, the value that our Baylor Scott White app has played in regard to communication. So many stories that we've heard from our patients about if in fact they did, have the unfortunate experience of either being exposed to COVID or being positive to COVID, there's always that awkward waiting period of time from when you got tested to when the results come back. We're proud to say that we were able to rapidly turn tests around. We actually averaged about 72-hour turnaround time from when you were tested to when you actually got the results. And you were able to immediately get those results through the app. So there was no waiting. There was no waiting till the doctor called you, although that happened, of course. But you could see those in real time. And we've heard so many patients that said things like, that helped us to know that our physicians were actually there with us every step of the way. Our care team was there every step of the way, and we didn't feel lost. And so we're very proud of that. And those are just a few examples of things that we've been able to do that we really feel good about.
And so it's really exciting just to kind of see the way you have been able to respond and adapt. I know, we're now 6 months in to this new normal. And I've been seeing, along with, the precautions about COVID and how to manage through that, I've been seeing the message about don't delay care and seeing that quite a bit. Can you tell us a little bit about that?
Doctor, you want to take that one, or I'll kick it off?
Yeah, definitely. I mean, yeah, so certainly. So in terms of preventing, so it's kind of called, now we're calling it medical distancing, or, that part, it's been so important for us to ensure that, we prevent cases from like sort of fueling forward and not having, things happen earlier on. So patients who have like symptoms like an appendix, like, like we discussed too, when, you have all the symptoms and then you kind of think, oh, well, is it really worth it to come into the hospital? And then usually that doesn't kind of play out. And then if you just wait and delay care, you end up kind of putting yourself in a position where you have to go to the OR and things have to go quickly. So again, like, like similarly, like I was saying, like medical distancing is not essential. Social distancing is, but if you need to come see me or come see any of us, like we are here, we will see you, we will take care of you. And it is so important that you never put off any sort of like medical issue, whether it's, oh, I have a swelling in my leg, it's okay, it'll be fine. But then eventually you may need antibiotics for it. So it's really important for you to come in, see us so we can treat you, give you all the antibiotics, like, so that way we get ahead of it. So we prevent you from having worse outcomes. And so like avoiding that medical distancing is such an important thing, and something I'd like to make sure we relay across to our like viewer panel and all patients and everybody out there, just so, go see your doctor. Like we're here, we will see.
It's such a good reminder that even as we're kind of waiting to, as this and kind of watching, we can't hold our breath for the whole time, right? We have to keep moving. We have to keep doing things. And that's, that's one of the reasons that at the Long Center in particular, we're so focused on finding new ways to create new programming, or finding performers that can continue going, like finding the ways that we can keep breathing and moving. And I think one of the other pieces that we have to keeping in mind too is kind of awareness of our mental health as well. I think initially when the virus emerged in March, there was a lot of anxiety just about this new virus, but here we are 6 months later, and it's a completely different kind of, our minds are in a totally different place. We've done what we can to find distractions, but the fatigue of it starts to become very real, and the mental health challenges, I think, continue. And so we're looking for ways to make sure that people can still have the distractions, the enjoyment, some pleasure. I'm curious to hear, what are you seeing, or how has your practice been able to help continue the care on for mental health issues? And it's kind of along that same line of that you were saying, like, don't just bottle it up. Don't just hold your breath. Don't just wait. We want to take care of you now as this is going on, and we can still do that. So I'm curious about how you've been able to support mental health.
Yeah, so one thing people tend to forget is, as primary care physicians, we see mental health, and we do evaluate you for it. And we are able to come up with at least some sort of like treatment plan to start you with. If we need to escalate, we can do that. But just making sure that, especially during this time, you have a place to come talk to, if you can't set up with certain other places, or at least giving you the resources. So reaching out to us for mental health is definitely something I always recommend, because as primary care physicians, people tend to forget that we also are trained to a certain degree about mental health and how we can help with that. So that's certainly something that I always recommend. And the things I've been sort of telling my patients too, specifically, is that just take a break from the news. Listen to it once a day. You don't have to listen to it several times a day. Just listen to it once and it will be good. I understand the need to know what's happening, but just take a break. It's okay, and it's good for you and your mental health. So that's definitely something I've been telling all of my patients.
They can come to the Long Center website as well and see some of our performances.
Yes,
Exactly. To connect with some music.
Yeah. Hey, Abby, I think along with the things that Dr. Mukkamala has shared, one of the things that we get concerned about quite a bit, and folks that are experiencing stroke symptoms or heart attack even, or an appendicitis, and they are afraid to come to the hospital because let's just talk about it, right? They're afraid they may, be exposed to COVID. And, the reality is it's actually more dangerous to delay than it would for you to be concerned. But I will tell you, the measures that we've spent to ensure that this is a safe environment so folks don't medical distance is extremely, extremely advanced. And we've always had infection preventionists that have dealt with some other infectious diseases that we maybe at the time were not as familiar with. This is certainly very different than some of the others, but we've learned a lot. As at Baylor Scott White, we're part of at least 20 different research studies that we're partnering with folks across the country to bring to bear resources and information to ensure that we can both treat and prevent the spread of COVID-19. So we're taking extreme measures to make sure if you need care, get care now, because we're here to support you along those various issues that you may face.
That's very exciting to hear, and I commend Baylor Scott White for really being at the forefront to be able to really establish those protocols and ways that people can continue to not just hold their breath or not just bottle it up, but be able to get the care they need. And we at the Lung Center a few weeks ago introduced, we're not ready to allow audiences to come into the hall at the moment, but we're doing our small part. We installed some park space squares, we call them. They're squares on our lawn where we know people are out and about, and we're providing ways that they can do that safely. You can come with your family, you can sit in a square, have a picnic, look at the skyline that you can see behind me. And I think a lot of folks and organizations are really trying to figure out ways that they can continue to serve people, serve their community. We want to serve our patrons and Austinites, and do so in a way that is meaningful and powerful. And Jessie, I know yesterday we had talked a little bit about some of the work that you're doing with some other organizations around town on kind of setting those same types of programs up. Can you talk a little bit about you mentioned YMCA yesterday when we chatted?
Yeah, so one of the things that we have, continued to try to do, we as an organization firmly believe in staying connected with community organizations. We're partners in this work to keep the community healthy, which is really what we want to do. We only want you to come to us if you absolutely need this. Otherwise, we want you to be at home with your family. And so like the Long Center, we're partnering with local YMCAs and Wonders and Worries and American Red Cross and Chambers of Commerce across the region. We'll talk a little bit about our, relationship with the Alzheimer's Association. And so we're doing a lot of different things, from virtual chats, having individuals like Dr. Mukkamala who are being made available to these various groups to talk about things that they want to hear related to their care, their health, and their wellness. COVID-19, which is a hot topic, obviously, for a lot of folks, and sort of responding to those questions. But as you noted, we've been able to reach communities that prior to this, we perhaps wouldn't have been able to reach as quickly and as many at one setting. And that has been really exciting to get the word out, to get information out, and make that available to the community at the right place and at the right time.
I think that's so important to keep people, the building connections and keeping the lines of connections open to keep people inspired. So I'd love to hear a little bit about Dr. Mukkamala, what you're doing to stay inspired and engaged, and particularly you've got long hours. What are you mentioned you're encouraging folks not to watch the news, turn the news off for just a little bit. When you turn off the news, what are you turning to for inspiration and support?
So, couple things. First is, I love podcasts. I think it's very helpful, and there are so many out there. Baylor Scott White has a few for sure that you can we can make available for you. And of course, there are so many out there for sort of mental health, because it's so important to kind of, at this time, reframe. When you kind of just keep focusing on one thing, it's difficult to detach from what's going on out there. So I think it's really helpful to listen to some of these things, help you reframe, realize where you're at, and then that really can help a lot. And other things is getting outside. Running, really just, people have been really good about like socially distancing and stuff. So even if you head out for walks, people have been so accommodating, and it's a great Austin, city that people love being outside, and people understand your need for space at this time too. So it's get out there, get some exercise, get some fresh air. We're all getting through it together.
And Jessie, how about you? What are some things that keep you inspired these days?
Yeah, I would say some of the same things. I've really tried hard to stay active. That is certainly something that we continue to emphasize amongst our team, and making time for that. The other thing that's really been inspiring, I really want to give a big kudos to the frontline caregivers. It is truly inspiring to see the degree of courage and tenacity, not to allow the fear perhaps of COVID-19 to stifle them from doing what they love and what they believe. And, we've seen staff here, we are, a faith-based organization. And so staff are praying with each other, encouraging each other, sending wonderful notes about, their experiences throughout this process, and really, taking time to be empathetic as people go through their own process of feeling one way or the other. And, when I see those types of things, that gives me more and more reason to get up every day and continue the work to help this team, our frontline caregivers, take care of patients.
I continue to be inspired as well by what all of the medical professionals and doctors are doing, and healthcare providers are doing to take care of our community. It's just really very inspirational for us, and it motivates us to be able to reply and return in some way, and provide some support in some way. We're running out of time just a little bit. Before we head out, I wanted to mention the Alzheimer's Walk that Baylor Scott White will be hosting, and that then we'll make a tour through the Long Center, through our lawn. So Jessie, can you tell us a little bit about that and what we should expect to see?
Absolutely. So like everything else, we're having to be creative with regard to what this is going to look like. Usually folks get together and they're doing a walk together. So we've got the virtual walk to end Alzheimer's Saturday, September the 26th. So if you're online, you can walk virtually there. The Promise Garden will be in the front of the Baylor Scott White Austin campus. We'll have over 1,000 flowers planted that day leading up to the walk. So Monday, September the 21st through Saturday, September the 26th. And then, as you noted, Abby, once the garden moves here, we're going to move the garden to the Long Center. And then finally, it will be at the Round Rock campus, Baylor Scott White Round Rock campus. And so we're really excited about the relationship and doing this work together. We're going to continue to fight.
Great. Well, we appreciate your partnership. And this is our final question for everybody, is a Long Center memory that stays with you.
So for me, I think like shows and stuff are fantastic, but I think every time I run along Lady Bird Lake and I kind of come up to that, there's like a hill where you can see the Long Center. It's just so nice to know that this city cares so much about art, that it's in the heart of the city, it's in the middle, and it's like right there, and just always makes me feel happy and good to know that I'm in such a great place and have access to such a great center so close by.
Excellent.
Yeah, Abby, for me, it was, so I've been to a few concerts there, but the one that really stuck out the most was you had a group there called the Black Violin. Mm-hmm. And, I didn't know what to expect. I have to confess, I haven't always been a big violin fan, but my wife, got us tickets and we went, and it was amazing. And the art form that was used doing the performance was wonderful. The venue was great. I mean, the whole nine. And so that's been one of the memories that I carry with me.
Excellent. Well, they're coming back. They're coming back. We're working right now on the schedule for when we can get them back in to join us. So keep an eye out for it. I want to thank you all. Thank you both so much for joining me today. We thank Baylor Scott White for its ongoing support and championing what we at the Long Center are doing. And it's moments like these where we can bring together different elements of our community to be able to show our support. Before I let you go, we do have one question from our audience that I would like to pose to you. We have a member who wants to thank you for everything that you've been doing and wants to find out how we can best support healthcare providers and the frontline workers who are doing so much for Central Texans.
Honestly, just, being there for each other. And then they've already been so great. We've already had so many people reach out for us and give us like various resources and things like that. So that way we can get through this. Our hospital systems have been receiving tremendous amounts of love from the community and things like that. So honestly, just keep doing what we're doing, and just realizing we're here for you, and we're gonna get through it together. Yeah.
I would echo those sentiments. The community support has been overwhelming. We could go on and on about the number of folks that have dropped in and wanted to donate masks or donate food, and it's really been great. And so, obviously the social distancing, physical distancing that people have been doing has helped us to see some curtailing. And we just ask to continue to do that so that we can get through this together as noted. That's our mantra, and that's what we would ask for.
Excellent. Well, know that we're all here championing you and cheering you on, and grateful for everything that you've done. Thank you again for your time today. And we look forward to seeing you at Del Hall as soon as we can all get back together again. We're going to be there leading the way. So thank you so much for your time.
Thank you very much, Abby.
Okay. Thank you so much, Abby.